consent form that I need you to sign for your total knee arthroplasty that we're gonna do in a couple hours. I'm gonna end up going over some stuff with you on here, you know, some really important things that we need your signature on.
Mrs. Brooks, so you had a few questions for her. You were a little concerned earlier. Do you want to?
Okay.
You want to ask her while she's here?
Because
Okay, I'm
I'm
on my
really
way.
concerned about.
I'll be there in just a minute. I have an emergency. I really need you to do this
She
for
had
me.
a few
I'm really sorry. I
questions.
know. Just please take care of that for me. Thank you so much.
Or maybe I can answer any questions you had. I can do my best. Okay. What are you most concerned about? What are your questions? Did the doctor explain the procedure to you?
She did earlier, but you know, the main thing, I'm really anxious and I'm really nervous about this procedure. Like, what if I don't make it out? You know, those are my concerns.
Well, do you have an advance directive or medical living will?
Well, I'm not sure because my daughter usually handles all of that, and she's at work right now, so I'm really not. I don't know what's going on.
Okay. Well, what we can do is I can check that for you. It should be in your chart if you do have one, and I can try to contact your daughter if I don't see it in there. But there's really no reason to be scared. We'll take really good care of you, and I know that it's a scary thing, but you'll be just fine. And but we do need to sign your consent. You're going to be getting really groggy, and you're probably not going to know what's going on.
Okay.
But I would like you to go ahead and sign this. The
Okay.
doctor's asked me to do it.
Okay. That's
Okay.
fine.
So if you would, please sign initial here, date here. Initial here. Good. Initial here. 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 Signature and date of birth. Good. And here.
Just want me to sign right here?
Mm-hmm.
Okay.
And then here.
Just my signature?
Mm-hmm. Okay. All right, good.
Okay. Thank you so much.
You're welcome. They'll be up to get you from the operating room any minute.
Okay.
Okay. And sorry she couldn't answer more of your questions.
It's okay. Thank you.
Well, I'll see you when you get back. Okay. Good luck.
Thank you.
Hey Shayna.
Hey, how's it going?
Well, the patient in bed 1 is having trouble breathing. I just wanted to let you know. That's all I have.
What do you
for
mean having trouble?
Well, he sounds really raspy. He can't catch his breath. Can't really talk to me.
Great. I have like 5 other patients right now.
Okay.
Everyone's meds are due.
Okay.
I'm really busy dealing with that. If you would, do you mind? Can you just go listen?
I'll go listen.
You know how to use these, right? They go in
I
your ears
think so.
this way.
Okay.
And you can just listen. If you'll listen to both sides of his chest.
Okay.
Okay, and then just listen to where you can hear his breath. If you hear crackling or anything, what I'll do is leave my computer open.
Okay.
Do you know what crackling sounds like?
Probably.
Crackling.
Okay.
Like crackles.
Okay.
Okay, just like what it sounds like. So if you hear that, if you would come back here, and I'll leave my computer open, just type here.
Okay.
I'll leave the
Yeah, just leave it open and I'll
where you leave
put it
notes,
in.
I'll leave it, you just type it in.
Sure.
Just say, heard crackles in the lungs bilaterally, whatever you hear.
Okay.
I'll
answer
check
it
it before I submit it.
Okay, sounds good.
Okay,
All right.
that'd be great. If you'll
Okay.
just let me know, keep me updated.
I'll
I'm
keep
really
you
busy.
updated. Okay.
Thank you. Okay, so Mr. Rogers is definitely gonna need a bed bath today. I've
Okay.
noticed he has some reddened areas also.
Okay. So I'll turn him when we're done.
Yes, please, every 2 hours he
Yeah.
needs to be turned. It's way worse than it was yesterday. And we also really need to be applying the nystatin ointment.
Okay. On where it's red?
Yes.
Okay.
Yes, that has to be done. But other than that, he's feeling much better. He definitely needs to be up and ambulating some today.
Walking around
At
a little
least
bit.
a few minutes.
Okay.
We're just gonna wanna, obviously watch his vitals.
Okay.
And if you just let me know how he tolerates it, that'd be great.
Sure.
Mr. Rogers, I have your blood pressure medication. Did you have any questions about it?
My name is Matthew. I'm an EKG tech. How are you doing today?
I'm okay.
How's your surgery go?
I'm in pain right now, but I'm just glad I just made it out of there.
Okay, I'm sorry to hear that. So today I'm gonna just check your electrodes and replace them if I need to. I just want to make sure your EKG monitor is working okay.
Okay, do whatever it is you have to
Oh,
do.
Miss Brooks. Hi, welcome back. How are you? You remember me?
Yes.
Okay. Well, I'm going to be taking care of you the rest of the day, okay?
Okay.
How's your pain right now?
My leg is like really killing me right now. I'm like in really
How would you
bad
rate your pain?
I would say like a 9.
A 9, okay. All right, well, I'll go check and see what meds the doctors ordered for you
Okay.
and maybe get some to you, okay?
Okay.
Matthew, are you going to be here for a while?
Yeah, I'll be here for another 10 minutes or
Do you
so.
mind reviewing the incentive spirometer with her? She needs to be doing it every 1 to 2 hours while she's awake.
What is that?
An incentive spirometer. She kind of knows how to do it, right? You remember a little bit?
Yeah, I can show
Yeah,
it. We'll figure it out.
Okay, great. That would be a great help. I've got a lot to do. But I'll be back and check you in just a little bit, okay?
Okay. Can
Thanks.
you please make sure the doctor gives my pain meds, please?
Yes,
Okay.
yes. Matthew, just let me know how that goes, okay? Thank you so much for your help.
All right, no problem. I got
Thanks.
this.
Thanks.
All right. And Senator spirometer. Oh, she said spirometer. All right. So.
Yes, it's just been a crazy day. No, I've had 8 patients. This is the first time I've sat down in 12 hours. Literally, I have 5 minutes to eat my donut. No, it's crazy. I'll make this freaking spaghetti when I
Shayna.
get home. Oh, I'll call you back.
What in the hell is going on with my patients?
You
Who
tell me,
listened
Dr.
who
Taylor.
listened to Bed 3's lung sounds?
I assessed him earlier, and there were no. I mean, we heard a little bit of crackle in his lungs, but
Okay,
Nothing serious.
nobody alerted me. The documentation is not correct. I don't know who in the world did that. It's signed under your name. Doesn't seem like you wrote it. Also, why in the world is the EKG tech in there teaching incentive spirometer to a patient? I saw him putting his damn mouth on that thing.
wow,
That's disgusting.
wow.
Are we not a hospital?
Well, Dr.
Also,
Taylor,
wait, no, more seriously, one of my patients bottomed out. Who gave that blood pressure matter? Who checked the blood pressure before giving that medicine? I don't understand, like, what is going on this floor today?
Okay.
Everybody's
You're right.
falling apart.
It's been a really hectic day. I myself have had 9 patients this morning. I also had to explain a surgical procedure to a patient, and that is not within my scope of practice. I am no surgeon. I also had to get consent signed in addition to my 9
Did she
patients.
die?
Did she die? I mean, no, thank God. My patient's back alive. Thank God.
Okay,
But
so
she
one
was
little consent
confused.
form.
She was confused. No, it's not one little consent form. It's her life. And she was confused, and I had to send her to surgery like that. So it kind of, I have 9 patients. I understand you're busy as well, but I can't do things out of my scope of practice because then it affects everyone else on the team. When I have 9 patients and I'm doing things like getting consent signed and explaining surgical procedures to a patient when I'm no surgeon.
Okay, well, next time you need to come speak to me about it instead of giving all these responsibilities out to these people who don't know what they're doing because we could have lost a lot of people today. Okay, thank you.